funds to get our HOSA officers CPR instructor certified. And we utilized them to do a lot of the certifications that we would have to do when we had a class full of 30 kids to certify, or when we had to recertify coaching staff and other staff. We actually had one of our head coach of 22 years, fall before last, had a massive MI and dropped dead on the side of the field. And the students jumped on it and were able to defibrillate him and get him resuscitated and got to the hospital, and he survived and was great. And we had a huge ordeal where we kind of brought him back for the first time since that had happened at one of the last football games. And we had a whole big hands-only CPR demo table that all of our HOSA students manned, and people would come by and sign in and get a blood pressure check and learn how to do hands-only CPR. So that was just crucial for them and for us to make them into leaders. The other thing I was going to ask is if you guys teach the Stop the Bleed within your classes.
Yes. I was going to talk about Stop the Bleed. That's a great segue into that.
There you go. That's what I'm here for.
So Stop the Bleed, is universal, and I'm guessing that you guys also are you're aware of that training. I don't know, in Tennessee, is that required? Anybody?
No, I was not aware of that.
Okay. All right. So Stop the Bleed is also something that HOSA is an advocate of, but Stop the Bleed is a nationwide training program, and it is specifically for stopping any kind of traumatic bleed, the fastest way to do that. And they advocate tourniquets and packing the wound, and it's training specifically for lay people.
Do you have, somebody just sent the link.
Okay, good.
Okay. Yeah, because Shelby County, they started the trainings and then they stopped them. And so I think Ms. Gleason and I were trying to get certified to help the students, but they stopped the training. So I think I saw somebody said they would put it in the comment.
Okay, great. And we'll also send it along with the slides also. Thanks, Rhonda. So Stop the Bleed, there are some, Rhonda, were you posting like the nationwide one that has all the stuff they can use? So you don't have to be certified to teach Stop the Bleed in your class. You just have to be certified to give those official, to give certifications to other people. It's not really that hard.
Well, I think that could be any of the science classes, because that's important for everybody to learn, even though I'm teaching physical science.
Yes.
Yeah, I think that would be a good one to take back. And that was my reason for signing up for this, this today, was to, learn something different and take something back.
Right.
It's actually good for all classes to do it. And I mean,
right.
Like with your HOSA second year and third year students, or not HOSA, your health science or whatever, with your second and third year students, y'all could do a huge push for it and actually just really bring notoriety to your program and to the leadership of these students. Other students will see them in a different light. And it really just, you can't make leaders unless you give leadership away and let these kids just kind of take what they know and run with it, and they just thrive in those environments.
Right, exactly.
Plus your local MRC group, Medical Reserve Corps, that's part of their mission. And you can find out who your local MRC person is, contact. Usually you can just Google Stop the Bleed or MRC Tennessee, something like that. And they would love to come in and bring you equipment to help you teach those classes. And I did actually a session at our state meeting with how to make your own Stop the Bleed thing. And Karen took a picture of her fake leg. She put her high heel shoe on it. So yeah, pool noodles. Definitely pool noodles. And it was some PVC pipe, and the pool noodle, I cut a hole in it and put some moulage stuff from Halloween. And so I had people practicing packing it and wrapping it and that kind of stuff. So you really don't have to have a lot of money, but I promise your MRC people, if you find out who they are, they're going to love to come in and help you out with that. Right. And they're, yeah, your fire stations and EMS too. Okay, so let's move on to one more way you can get your students some experiences in the community. That's the next slide. So I'm wondering, do you guys know who your advisory board members are for CTE? Hopefully you guys go to the advisory board meetings when those are at least once a year. Hopefully, maybe throw it up in the chat if you've been to those advisory board meetings, or if you want to speak.
Yes. Our own advisory board meetings?
Yeah.
Yes. I have my own. So I'm in a high school, and we have one big meeting for all of the CTE teachers, and that has been wonderful because we've shared advisory board members, and they've been helping more than one group. But then at the end of the year, we have 2 meetings with just our discipline, and so we have 3 meetings a year.
That's awesome. That is so awesome, because not everybody gets to have them that often, but that is great. So if you're able to build relationships with your advisory board members, and I know that it's hard. I'm having that experience right now, as a matter of fact, in a virtual school, because our students are all over the state. We're trying to get them work-based learning experiences, and the people that we reach out to say, oh, no, we have to make room for the schools that are in our area first, and we don't have room for all of them, and we haven't been able to get our students very many work-based learning experiences yet, and we're looking for alternative ways to do that. So know that I feel your pain. I really do. So you can also talk to some of your school district board members, the people that are elected to help the schools. Hopefully there's somebody in healthcare or somebody at a office of some type. You might be able to reach out to them and ask for if they would be able to partner and let some of your students in. You can also increase those experiences with the community by inviting outside guests to come in and speak. Maybe they're members of the school board, maybe they're members of your advisory board, but they don't always have to come in physically to speak to your students. Haven't we had enough of Zoom meetings this year? Haven't we? Even now. So use that. Now that we know how to do that a little more easily, then hook up with some of those folks and just arrange a time and record it, just like we're doing now. Have your outside speaker speak to one class, record it, and then play it for the other students. There's all kinds of ways we can get around the physical barrier by using some of our virtual tools that we all got lots better at out of necessity the last couple of months, right? So my other suggestion is, if you have an advisory board meeting, I'm wondering, and I'm not sure what you guys do you have any students make presentations at the advisory board meetings? How about you, Miss Mia? Do you have students present at the board meetings?
Yes, I do. At the big one for our school, we have our students report the things that we have done. We have that's the other one, Acadian Ambulance. We have 3 students who go on Tuesday nights, and they were training from August all the way till February. And so they went to 3 events. They went to a Lakers game with the Grizzlies. They did Mercy, Me, and another one. But they went to 3 events and they actually rode the ambulance with them. And so they had to go to our meetings and report what they've done, what that experience had on their career and all of that. But they do have to go, and I appoint who goes, and it's usually the officer team.
That is smart planning. So smart. So yeah, if so my other question is, your advisory board meetings, are they for the whole district, or does everybody have their own?
Everybody has, in Shelby County, we do it by school. And so your school has an advisory board meeting. We
Mhm.
haven't had a big one for all of us yet. If y'all want to, we can, but we do it per school right now.
Okay. So, and Patrice, I see your comment that thank you. I wasn't sure. So, in my district where I used to work, each one of the schools that had CTE programs had their own advisory board meetings, and then the technology center had a great big one too. So here was the issue. They made the individual schools pay for the meals or whatever that we had for the our own advisory board meetings. But you know, at the technology center, they had a big barbecue thing and wasn't that nice? So we we finally our school asked to join the big group because of it was more cost effective and we could also share some of the same advisory board members and that worked out a little bit easier. So only you guys know how that's going to work out best for you. But your advisory board is an awesome source of making some more of those connections and also um, publicizing that as much as you can, not just the advisory board minutes, but also publicizing it on some social media websites as your school allows. Obviously, there's a bunch of stuff you have to do with that, but if you don't tell your own story, somebody else is going to tell your story, and it might not be the right way. Okay, so some of the other things you can do is to try to do field trips, and that's our next slide, Nancy, when you get a chance. You can increase your students' interactions in the community by taking field trips. Even if you can't get all of them to do internships, you can take some field trips, and Perkins will cover that a lot of times if you make arrangements ahead of time, not after the fact. It's kind of hard to get that taken care of after the fact and certainly late in the year. But think about some of the places you could take field trips to. And if it's a couple hour field trip, well, that's about as good as doing a job shadowing experience sometimes, right? Because, you know, sometimes when students job shadow, they tend to kind of stick them in the corner and they might not get to see all the things that you would like for them to see. So maybe be thinking about some of those places you could take some field trips. Like, I'm not sure if you'd be able to get into very many pediatric places because everybody wants to be a neonatal uh, nurse or what else is the OBGYN doctor. Anybody else have that experience? Everybody wants to do something with babies or they want to be a surgeon. Nobody wants to be anything in between. But we need those in between folks, don't we? Okay, so like I said, Perkins can cover a lot of that. So let's see, making some of those field trips, maybe you want to make a part of it your second tier classes, maybe not the introductory class. I saw that all of your pathways have pretty much the same introductory type course. Health science, I'm trying to think of the name of it, but kids on a field trip. But the second course in your pathway would be a good time to plan to take your students to the local EMS headquarters or to a technical college nearby and have them experience some of those scenarios and some of those awesome learning labs where they have all the expensive simulators and everything. And you could also perhaps have your seniors do some organized visits to the local community college health science programs that they're interested in. Sometimes I like to have my students go and visit a local technical college and see the therapy programs, the respiratory programs, not just the nursing and the pre-med and the regular 4-year programs. I wish they could all be surgeons, but I think it's good to stress to your students that they can seek out the technical pathway before they get to the professional pathway, like a CNA if they want to go into nursing, or a physical therapy assistant before they go into physical therapy, that kind of thing. Because not everybody's got all that they need to make it straight into medical school, but it sure does get them a lot more experience and make them more prepared for postgraduate work if they can get some technical experience in to start with. Okay, so let's go to the next slide. Nancy. Okay, so if you set up internships for your students, if you're able to get that far, can I ask, is anybody able to do an internship program? Anybody having luck getting internship programs in your district? Can you put that in the chat, or if you want to unmute yourself and speak and share?
What was the question again?
I said, is anybody having good luck getting your students in for internships? I sure would like to hear what some of your experiences are.
Right now, I just go off of parents. So if a parent is at a doctor's office or a cardiology group, I have been getting them to let their child go. So that's one less child we have to do internships for. That worked very well last year. Also with speakers, we did the same things. The other way that I did it is the students that used to be in HOSA, I have asked them, they're nurses and doctors, right? Well, I only know one doctor that is a former student.
Wow.
But I've been asking them to come back. And either they'll come and do a demonstration in my classroom. One young man, one of my friends is a nurse, and she is over a nursing program. One of her nursing students who just graduated came and set up an entire lab. He came one day, looked at what I had, came and set up an entire day of a life of a nurse. He had a whole scenario. It took 2 class periods, and it was wonderful because we do like getting the student go there students and made as a life of a nurse. But I've been going through parents, old students, and then family members so that my students can get that experience.
That is great. So that does work a lot of the times. And the students that you have going out with them, are they first year students like in the introductory course, or are they in the second or third course in your pathway?
So the first year students get to go to the zoo, and they get to go in the veterinarian. They get to talk to the veterinarians because they don't let them really tour the hospital anymore. And then they do a A&P lab at the zoo, which that gets them out of the classroom and have fun. But usually it's the second year that gets to see most of the hands-on sitting right with a professional. And so next year, this coming up year will be my third year students. But the first year just gets speakers and hands-on in the classroom. And I try to save all of the side-by-side professional stuff for second and third year.
Right. That's an excellent practice, because if we let too many of our first year students into some of those situations, it could kind of burn a few bridges if there's some unfortunate situations. I'm not saying you should never do it, but that's one of the reasons why you have to be super cautious with how you select the students to go out to those experiences. So just think about, if you don't have a set system for doing that kind of thing, think about meeting with guidance. If you have anybody at your school that could help coordinate that, a lot of times it's up to the individual teachers. I was lucky enough to have a career specialist who was a person dedicated in guidance for coordinating those outside experiences for all students in all areas. But you really should try to safeguard your internship experiences, job shadowing experiences, whatever they are. It will be a lot easier to continue to send more students if you have built a foundation with a rubric, some objectives that are agreed upon by the advisory board, ideally, and the person who's providing the experience, because ideally you shouldn't, not that anybody would, but ideally you should have a set of goals. My former school, we would actually leave an evaluation form that we would have the student take to the person, and the person would fill it out at the end of the day and fax it back to us, and that made the student a lot more aware of some of the, keeping their cell phone put away and that kind of thing. And you can tie a grade to that, but there are just a lot of things that if you have time to prepare and put those in place, it will help you when an administrator per se is trying to get you to send a student to an outside experience that you feel like may not be appropriate for a lot of different reasons. I'm thinking specifically about behavior. But if you have agreed upon objectives and if GPA is included in that, and it's okay if it's not, or if you make it a part of your course, you really should have some guidelines written up ahead of time that are as objective as possible so that you have a leg to stand on if there's a situation that comes up later. You could also tie those outside experiences to certification programs and then arrange some kind of experience related to like the CNA students. Of course, they're going to have time in a facility. They have to be able to sit for the CNA exam. But if you have any other outside experiences that you could relate to, okay, if you earn your CPR certification, you'll get to go on a ride along, or you'll get to do this. It's just some thoughts, the way you can tie that all together and to dangle a little carrot for the students to get those certifications too, so they can earn those outside experiences. We want to give them to everybody, but we know that we need to have some things put in place to make sure that we're protected, the student is protected, and the potential employer is protected as well. A lot of nursing homes really love for high school students to come out and volunteer and sit with their patients and do recreational stuff, not just hands-on stuff.
Yeah, I just wanted to share, I had some classes years ago where I got to take some seniors to St. Jude Hospital. And they got to talk to doctors. I used to work there. I used to work there for 9 years back in the 90s, and I already knew some faculty and some doctors that were still there, and they welcomed me to come. And I took a couple years, I took some of my seniors there, and they got to talk to doctors. They took back some goodies. They had a gene chip that the doctors gave them to take back home, and they had lectures from some of the doctors on what they do in the labs. So that was something that I did years ago when I had a lot of seniors, and I just wanted to share that.
Is that Miss Richmond talking?
Yes, ma'am.
Are you with Shelby County?
I'm at Southwind, and before you came on, I teach physical science now.
Okay.
And that's mostly the lower grades, but I'm like, I've been in teaching about 21 plus years, so I've had a variety of classes and different grades over the years. So when I had a lot of seniors years ago, and I took them, I just wanted to share that I did take a couple groups to St. Jude years ago, and they loved it. They loved it.
Well, you still should grab on to HOSA. You would love HOSA. I'm quite sure David Downs and Miss Jackie wouldn't mind, but HOSA is great. Okay, I couldn't see your face. That's why I was being nosy.
Okay, well, I can turn on the video. Well, I don't know. Let me look at my background.
And Miss Richmond, I didn't know that. I didn't know that was your background, Miss Richmond.
Yes. Yes, it is. I worked in research for 10 years before I started teaching.
Oh, that's great. Yeah,
wow.
we gotta get you involved with some HOSA stuff. Yeah, I didn't know that.
Yeah, I've taught a number of different subjects over the years. So, kind of been exposed to a lot of different, subjects.
That's awesome.
Miss Richmond, I think that's what so many teachers, on the academic side, come straight from their post-secondary program, and teaching is all they know. And while some of them are excellent, it is nice to have people with varied backgrounds like you. And many health science teachers across the nation have been health professionals in their first life and then transitioned over to the high school classroom to engage young people. So what a nice blend you have there of some other experiences that
Right. And I
that
remember when we used to have Southwest, they would give us a lot of supplies during the year. That was back when they used to give us the bacterial transformation kits. And we used to have a lot of stuff a long time ago that we don't have now, that I used to use with my students. So they don't have the funds to do that anymore. So that was pretty good.
Hmm. Goodness. Well, that's awesome. I just love hearing y'all share with one another, and there's so many things that we can borrow from one another. Beg, borrow, and steal is one of the best mottos for our teachers, right? Beg, borrow, and steal.
Right.
And the best PD that you can get is sometimes from a teacher down the hall or across the way rather than somebody with a wonderful, awesome pie in the sky idea sometimes, I think.
Right. I keep turning off my mute because after I signed up for this meeting, I had a bathroom leak and I have some guys over here working. So I
Uh-oh.
have to keep my mute off so you all won't have to hear all this noise in the background.
Okay. All right. So let me move on forward and kind of speed up a little bit. I'm glad that we've had all this discussion about some really super important things, because if you can't connect what you're teaching in the classroom to the real world, then what good are we, right? Because that's what CTE is all about. And sharing these ideas is awesome because it's only going to improve your student engagement and improve your enrollment and therefore make everything better. So the next slide, just real quickly. I just really can't stress enough to you that you need to tell your own story, everybody. You can build your program and get your community folks even more involved if you put your story out there in the community. And I know that some of you might not be, I'm trying to think, who said that they didn't do Facebook? I think it was last week. I know that that might not be your favorite thing, but you have to get a hold of some of these awesome things you guys are doing in your classroom and find out what your school policy is. And you might have somebody in the school that's assigned to school publicity, but they usually have a hard time going looking for stories. But if you have some pictures and you can have the students face the other way where their faces aren't in the picture, but take some pictures when you're teaching CPR. Take some pictures when you're taking them out on those activities or when there's a guest speaker. But the more hands-on stuff, the better. And find out how you can get it on your school's website or in your school's social media feed. If it's Twitter, if it's Facebook, if it's something else. If it's having students present at the advisory board meeting so that your advisory board goes home with warm fuzzies, that's great. But guys, the people in your community are passing stories around about your school. Might as well give them something good. And I'm sure that they are being supportive of you. I just mean that CTE is not in the spotlight enough, and it really should be. And especially with all this virus stuff going on, guys, the platform is there for you to reach out and share with the community, share with the parents. Maybe, I don't know if you have PTAs. Usually in high school, they don't have PTAs anymore, but any kind of parent groups you have, or a school improvement council, oh my goodness, that's a great way to share stuff that's going on in your program and to make it more popular, especially your emergency preparedness stuff. Please figure out maybe one way next year you can share once per semester something going on in your classes, and that will make your administrator happy. Guidance will remember you, and when things come up, they'll call you more readily, and the school board will get wind of it. There are awesome things going on at school XYZ, and I promise that is one of the reasons why my school at White Knoll has gotten a lot of good publicity, not because health science is we're so much smarter there, but because we put out those positive stories every chance that we got, and we took people to conferences and we would publicize that. So please think about publicizing the awesome things that you guys are already doing. So let's go ahead and go to the next slide. Which of the activities, guys, that we've been talking about, do you feel like you would feel comfortable with trying next year? Maybe just throw one out, either in the chat or unmute yourself. What's one of the things we've been talking about in the last hour or so that you think you might want to try?
I would like to do the Stop the Bleed. That was like Rhonda said, all students, that should apply to all students, because never know when they're going to be in a situation where they have to perform, an act like that, and they would already have experience and know what to do.
Right. So that's applicable to any kind of emergency that you might be in, not just school, a car accident. The videos that come with that are talking about coming upon a car accident or just accidents at home. So Stop the Bleed sounds like it's one that folks are wanting to try. Anybody else have any of these things we've been talking about, or something that you've heard from another teacher, something you might want to try?
Well, I would like to also, do more field trips. I shared with you the one about, I took a couple of groups to St. Jude years ago. I
Right.
would so much like to, do that again.
Yes.
And I think St. Jude, there's some rules. The students have to be over 16, I think. And that's why the seniors
It's
was a good
Richmond.
group to do. Yes, ma'am.
Do you have Scholars of Tomorrow? Have you done that with St. Jude
Scholars, no.
of Tomorrow? I can
haven't
send
done
you
anything
the
with
link.
them lately.
Okay, so my students went this year and they've gone for the last couple of years. The students have to write an essay and then they pick them and then they spend an entire day with the researchers. That it was even better this year. I can send it to you once they send that link out. If you send me an email, I can send you my email address so I can have your email address. But that's another way that your students can get involved again with St. Jude.
Okay, great. And they don't have to be seniors. They could be any grade.
For St. Jude.
Okay, so send me your email. I think she's got a mute on.
Okay.
Yeah.
So if that's something that you're able to send out to all the
Can you
health
hear me?
science teachers, that would be great. Okay, does anybody have another one you want to share? Okay, so the next slide, Nancy, from all the things that we've talking about, what are some of the ideas that you have for building relationships with the community or in the school? Is there anything that anybody would like to bring up that we haven't already talked about? Does anybody else have a suggestion for ways that you can build relationships with students, guidance, anybody? Rhonda and Karen, you guys want to throw in something?
Yeah, so with my students, we have a lot of athletes in our school. It's a magnet school, so they go back to their home school for athletics. I try to make, like a big rival game within our district so I can get two schools at once and, not cheering for one team or the other, but just cheering for the students that I have in my class or students that I've seen in the hallways. And they really appreciate that. I know that when I was at my other school, it was a much lower income, and those students really appreciated just having their teacher show up. You would have thought that I was, like Beyonce or something, because they're like, oh, did you see Miss Edwards came to my game? Or, hey, did you hear Miss Edwards couldn't make it to my game, but she asked me about it the next morning? Or, did you see Miss Edwards at the school play today? Or, like last night, she was cheering for us and clapping. So just ask them about their outside lives with the students, and it really means the world to them. That you care about more than just their grade. It's them as a person. How are they doing today? You know, is there anything you can do to help them to make their day a little bit better? And definitely greeting them at the door and letting them know from the very beginning. And I know it can't be done every day.
Right.
I have to go use the bathroom, shockingly, between the hours of, 8 and 4. But definitely making sure you can make that connection with the students is important.
Right. So building on that student relationships, if you're doing everything else right and you don't have good rapport with your students, it doesn't matter how good all your experiences are. Right. So getting their buy-in with things that you do in class as much as you can,
Mm-hmm.
which is not the same as getting their approval, but getting their buy-in, like how they can see why doing this is important. Because in the healthcare field, you don't want somebody doing surgery on you that cheated to get their boards, right? So ethics, classroom procedures, equity, respect, all those things. I think it's easier to get kids to buy into activities when you say, okay, I realize you don't feel like doing this today, but you can see that if you are thinking about going into healthcare, then this is a really important skill. You don't feel like getting on the floor to do CPR, but would you want somebody doing CPR on you that only practiced on a mannequin, but they weren't really going at it full tilt, right? But you should know your students and not just their grades and their data. And I feel like you guys are those kind of teachers because you're here, you're wanting to know more, right? So there are lots of things that you can do to get to know your students better. Greeting them at the door is something that is kind of hard to do, but I make myself do that when I'm in a brick and mortar. Also, I teach the new health science teachers in our state program that teachers have to take to get certification. And I even make myself do it then, even though I'm getting my stuff together last minute. But that's the time when you can stop a lot of potential problems when somebody's walking into class crying, when somebody just looks mad at the world. You don't have to force them into a conversation, but just some kind of acknowledgement. Hey, Karen, how are you? Hey, Rhonda, good looking outfit, whatever, anything like that. It really helps the students buy in. It helps your classroom environment. And I would love to hear if you guys have anything that you do routinely in your class, but I would suggest that if you get a chance to this summer, do some volunteer work where you could also build some relationships in the community that might help you be able to take your students out there. Volunteering with MRC, if you're a healthcare provider, is an awesome way. You could take your students out to some of those disaster preparedness things and go into HOSA. If you get a chance to go to ILC, not this year, but that is an awesome thing for you to do on your own time this summer that you could bring that back to students and help them get better prepared for next year. And Karen does something in the summer with Envision. And Karen, can you give us the short version of what that is?
So the short version of Envision, it is a worldwide program or company that provides opportunities for students to pay to go out for 9 days and do anything from culinary to advanced medicine. I have been asked, or I was asked, to nominate students, and before I nominate for anything, I do background on the company. In doing the background, they asked me to actually go and work for them last summer. So I had the opportunity to work for them because, let's face it, teachers need more money in the summer. And the reason why I wanted to really kind of talk about it was because that program really changed my entire teaching for this year. I had known that I wanted to flip the classroom, but didn't know, what to really do other than that and how to make my program better. They take building relationships that sometimes in a brick and mortar, we take, a month or so of school, just trying to get to know all of our students, where they took 350 students and kind of broke it down in groups of 25, so about what we would have in a classroom. And they gave you like less than a day to get to know the student, get to know everything, like as much as you can about them, get their buy-in for what we're doing, and, all of this other stuff in less than a day. And I was sitting there thinking and training on, these people are crazy. Like, they are crackheads. They don't know what they are doing. There is no way. I've been teaching for 6 years, and there is no way a high school student is going to do a callback where I say flat tire and they go, shh. It's not going to happen. But it worked, and the students loved it. And I still have students from my sessions that will get in touch with me and email me, and just to check up on me during the COVID crisis and after hurricanes and just everything else. And they, at the end of 9 days, they're crying because they're leaving you. And, like we were crying because, hey, we've been working 15-hour days and now you're gone and I can sleep. But at the end of it, we miss them. And they really did show me that so much prep work and the lessons was needed. Everything was prepped in advance. The lessons that we were doing, they were written out word for word, what we needed to say, what you could, kind of ad lib on, on our part. And that's where I realized, what, I kind of knew what I was teaching, but I wasn't doing enough prep work. And holy cow, you mean high school students want to know what their stuff is a week in advance so they can prioritize? Who knew? Like, I would just give homework the day before. So it was little things like that that really helped me. And then building those relationships. I also was able to build relationships with community partners. And, I've got the Dean of Medicine from Morehouse School of Medicine down in Atlanta does virtual meetings with my students now. I've got Live PD, which I stalk, and they come into the school. And then we've also had Sean Stix-Larkin, one of their, co-host or whatever, do stuff. So it really does show you how to get out there and then build those relationships early on. So
Right.
That's kind of like the quick version, and I might cry thinking about some of it, but because I'm going to miss them this summer.
Right.
I have no idea.
So not everybody has the ability to go away to something cool like that. So
Yeah.
in our district, we would have for the middle school students who are coming up into the high school, we would do something like a scrub camp or something like that. We have it at the school at one of the centers. We would invite people, students from all over the district to apply, and it was a week long, and it gave them a taste of every health science related pathway with some fun activities. And then I think about asking, in your district or, if they do anything like that for any other programs, well, why wouldn't they want to do health science? It's one of the, you could tie regular science into that too for like epidemiology and that kind of thing. It'll help get the students kind of excited about things like that, and you might have some better, might have some good signups and that kind of thing. Plus this good publicity. So that's something cheap and free that you can arrange at your own school, and something else to stir up your enrollment. So I know the time is running down quickly, so I just wanted to jump ahead. If you have something you want to add, maybe put it in the chat, but I just wanted to jump ahead to lesson planning, because we did put that down as one of the things we just wanted to throw out some bits, and all of us can share some of our experiences. So your regular ed person is going to say, your lesson in general needs to have much less straight lecture if possible and more group activity, individual activity, and start with something to generate interest. And your regular ed teachers are going to call that a hook. Your hook is not necessarily your bell ringer, but a lot of people use bell ringers. And like in health science, I've heard a lot of health science teachers say they use medical math Monday. I would be real depressed to do math on Monday, but whatever. You can do something fun on Monday, medical terminology Tuesday, current events Wednesday, so on and so forth. You can make it something simple so that every day they know what day of the week it, what the nature of your bell ringer is going to be. You don't always have to grade it, but we know if you don't have some kind of consequences for it, they're just not going to do it. So you can make that look a lot of different ways, but a hook is usually something like a quick piece of video or a quick activity where they don't really know what to expect, but it makes them think and go, huh, I want to know some more. Like, I like to show Mr. Bean, if you know who he is, a Mr. Bean CPR or the Office CPR video. It's funny, it's what not to do, and it generates their interest. Or you can do a hook where you pose a question and you get the students talking about health disparities as a segue into legal and ethical. Chances are the kids these days are not aware of some of the awful travesties that have happened in the name of science. Like, I love to talk about Henrietta Lacks. And I'm ashamed to say that I did not know who Henrietta Lacks was, only the most important human being of all time, up until a couple of years ago when I read that book, The Immortal Life of Henrietta Lacks.
I
So
used to use Gila cells every day.
you did.
I grew them for years.
Right.
Yeah, so I had a lot to tell the students about those. They were tough sales. I mean, you couldn't kill them for anything. It took a lot.
Right. So
And in a lot of our projects.
right. So last year I actually got to go and hear the best friend of Henrietta Lacks and the author and a great granddaughter speak at something in Augusta, Georgia, and they talked about Henrietta and that whole process and the book and all that kind of stuff. And the author explained, okay, I could talk for a long time about that, but there's a reason why those are so hardy and other cancer cells aren't. But anyway, so that's an example of a hook. And then that helps segue into a short guided instruction, short lecture, please no more than 15 minutes, and then give them something to do. And high school students don't want to sit there and listen to a lecture. That might be how all of us grew up in school, sitting in a lecture, taking notes, but that is really not how we should be teaching our classes now. Not because it doesn't work, but because the kids tune out a lot sooner. Maybe you can use that in your third or fourth level classes, but group activities, facilitating them is a good way to get students more involved, pay attention, and they're paying attention to what each other is doing. They're listening to each other a lot better, a lot more easily than they're going to listen to you, sad to say, unless you're telling a really great growth story. That's my favorite thing to do when I see them start nodding off, is tell something really gross. So let's talk about our lesson planning just really quickly. Lesson planning is one of the most boring things as a teacher that you can do, right? Is there anything more boring besides putting grades in the grade book? Lesson planning is boring. Thinking up cool activities is fun, but putting it all down. If you're not a fan of digital learning, and it's okay if you're not, if you like to use hands-on flip charts, whiteboards, agendas, I really recommend that you have some kind of agenda somewhere in your classroom every day. So even if it's just a part of the board, then you can write in what we're doing today, the activity we're doing, and what our wrap up's going to be. If your administrator is not asking for that, well, they should be. Or maybe they don't have time to come see what you put on your board. but putting an agenda will save you a lot of time when the kids come in and say, "What are we doing today, Miss Haynes?" Point to the board. "What are we doing next?" Point to the board. "When's our test?" It will save you so much time if you're able to put some kind of agenda together, either electronically on the classroom website or somewhere in the classroom. I think I hear a few people saying amen out there, right? Don't you get tired of answering questions? Okay. So my other trick that I do with students when they want to ask me something right after I get through giving directions is I say, ask your neighbor, or ask three. Some people say, ask three before me. Hopefully it won't take three people. Say, did you ask your neighbor? Then yeah, they love to tell the fool who's asking the question what everybody else knows, but not them. Let's see. Keep in mind that assessments don't always have to be graded. So when you do, our administration wants us to do formative assessments and summative assessments. But most of us have been in healthcare and we know how to do physical assessments, right? You can do it like that. Look at a twisted ankle and say, okay, circulation, this, that, and the other. You know how to do that. Lesson planning is the same way. When you assess your students' learning, it's the same thing that you did when you worked in healthcare and you're assessing a patient's condition. Or if you're a lab person, when you're running the test, you know the things that you need to assess to make sure that that test is going to be valid, that kind of thing. So next time you're doing a lesson plan, think about it that way. You know how to do this. What do you need to see or hear from the students to know that they are learning what you want them to learn? And that can be them turning and talking to one another. That can be a KWL chart, what I know, what I want to learn, so on and so forth. There's a lot of different ways to do that. And I think if you just add in a few more of those things, it will make life a lot easier for you. Okay, beg, borrow, and steal. And just kind of going through the rest of this kind of rapidly. You're getting to know some of your other teachers in your district. You got a good group together already of some folks that you can call or email and say, hey, remember when you were talking about that thing? Please don't try and redo it for your own school. Please just steal it, change your name at the top, and see how it works for you. And then you can change it up, the next time you do it when you get a little more comfortable with it. Stealing is a great way to pull together activities so that you can figure out what is going to work best for your class. Because not every class is the same. Not everything works the same way. Social media groups, we talked about this last week. Social media groups are an awesome way to get ideas for activities. And even if you don't like Facebook, maybe just get an account to join some of the educator groups. And I know that some of you signed up and got on the HSEA Facebook group because I'm the one that approves the membership. So thank you, Jacqueline. I saw your name and I saw some other ones. Let's see. And when you're doing digital learning, already do this, but don't have a technology thing as your only lesson, because every time you do, what's going to happen? What's going to happen is going to blow up, right? Just like today, just like my PowerPoint today, I had everything prepped, right? So always have a backup and never give, my opinion, never give students only a project to do for like 2 days in a row. Because here's what happens. If you give them 2 days to do a project and you have nothing else for them to do, they're going to either A, finish it all the first day, play the second day, or the opposite, or do nothing at all, and second day say, I need another day. Okay, so my suggestion to you is you have a couple of things going on at the same time. So maybe the first part of class, you have a mini lesson, and then you say, okay, when you get done with this, then you can work on your project. That way, they're not time wasting as much. And that way, if the technology doesn't work for whatever you're going to have them do, then you can have them work on the project. If the project, something that's going on with that, then you can revert to the other activity you were doing. And if all else fails, if you have nothing else that is working for you, do a current event, because your students all have phones. You know they do, because you're wrestling with them every day, right? If you have a current event and you ask them to look up a current event, something medical or health related, they can look it up and write on a piece of paper with a pencil or a crayon or whatever, 2 paragraphs about whatever that was that they read about. Current events are always a good idea, always something you can throw in at the last minute. Okay, so does anybody have any suggestions for last minute health activities? Karen, Rhonda, anybody? What are some activities that you throw in when nothing else is working and you got to think of something real quick?
Yeah, so I know with me personally, if technology is going down at my school, I've got a pile of dominoes that I made where on one side is the term, and then the second part of the domino is the definition for the next domino. So they just, I mean, it's a line. It's not like fancy domino or anything like that. But if that's great, you can just pull them out. They're laminated. It's review. Easy to go. Some of the other things, you can buy games. You can actually buy a game called Pandemic if you have the money for it. But the dominoes is one. I've done it where it's quilt. So it's 4 sides, and then they have to like make a 9x9 thing. Those take a little bit more time. So I, try to prep some things over the summer for units that I'll know, and then just pull them out when we get a chance. If all else fails, man, YouTube is great. And Dr. Mellick, Larry Melnick, or Mellick, I call him my good buddy Larry, but he's got great videos. And for like emergency sub plans, because for, lesson planning, that's always, I don't feel good, I've got the flu, I've got a migraine. My kids know if I'm not caffeinated, I get migraines easily. So the Great Diseases curriculum by Tufts University is great, and I absolutely love that. A book to read that you could, if you get a chance over the summer, versus being at the pool or, the beach or something with things still kind of being closed down, is Hacking Discipline. And that is a phenomenal book about building relationships, not just with students, but with your community members, and how that helps discipline within your class as well. And my class will tell you, I don't play, but I absolutely love my students, but just don't tell anybody. It's a secret.
And any kind of game that you can throw in, there's all kinds of research and statistics about, they call it gamifying your classroom. Anything you can do to make a game out of something. If it's review, if it's who can, make the best poster for washing your hands or anything like that, it is a huge incentive for students.
One of the fun things that we've done, I think it's been one of the favorites that we've done every year, was I bought a game of headbands. And we made the cards to where it would be different units. So each of the units were done in different colors, and I keep them rubber band around them. And so the kids I'll put them in groups of 4, and they'll have to put the card up on in their little headband, and the rest of the team's trying to give them ways to guess the term. And it is literally, it's how we would do test prep for our completers test, our midterm tap out, our final, anything. They love headbands. And I think I got it for $8 used off Amazon or something. So lots of those in the pocket that I can just pull out.
Okay, so we are getting close to having to wrap up.
Hey, Katrina, I went back to the resources one. Did you want to mention about the CDC or?
Yes. So the CDC has tons of lessons that were written by teachers during a fellowship thing, and I got to say some of them are kind of complicated, but there are a lot of activities in there that you could for free go in there and pull out and just use parts of it. So you go to the cdc.gov website, type in the search box lesson plans. That's all you have to do, and it will pull it up for you. So that's a really good one. So I was going to say, if anybody wanted to stay on after we wrap and discuss activities, you're welcome to. But Nancy, do you want to do our closing
Yeah,
for us?
I'll be happy to. Let me make sure. Am I unmuted?
Yes.
Yeah, okay, great. Okay, thanks everyone. I see that Amanda had put in the chat the SurveyMonkey link where you could go in and give us some feedback that might be helpful to us as we'll close out this series next Tuesday at 2 o'clock Central Time, 2 to 3:30, and Rhonda will be the speaker for that one, and she'll be accompanied by Katrina and Karen as well. But we just thank you all for being here this week, and we promise we'll save a few more minutes at the end next week for open discussion and questions. But you've been a great audience. We appreciate you being with us, hanging in here with us for 90 minutes, and we look forward to seeing you next week.